For this week's video, we're going to be talking about misalignments. We're going to put out some frames on a patient and we're going to be talking about what is affecting. Then we're going to see it from the front, the sides, and the top. Then we're going to take them off, fix them, and put it back on. Okay, here we go. For these frames, I have the lens that is sitting higher on the right side than the left side. The bridge is crooked. Notice the right lens is higher. This can affect the temporal parallelism. This misalignment is called skew bridge. Now I'm going to demonstrate how it looks like on a patient's face and what is affecting. Okay. Nice and tight. So let me just adjust the camera. First things first, I'm going to be noticing the front view and I'm going to see how it looks like from the front. And I notice if the temple's correctly aligned. The right side of the lens is sitting higher compared to the left side. The middle of the bridge is crooked. From the top view, I notice the misalignment that is sitting higher on the right side. From the side view, you can notice it from this angle that is sitting higher in the bridge. Now I'm going to demonstrate how to fix a skew bridge. In order to fix the skew bridge, you need to hold on to the eye wire and go to the direction that you want. So in this case, this side is higher and the bridge is crooked. So we want it to be in the same horizontal. So I'm gonna hold on to the eye wire and bend the bridge to the desire that I want. It's for it to be perpendicular and flat. Because these are metal frames, some metal frames you can just use your hands and just bend eye wire. Notice now the bridge is nice and straight in the same horizontal line. Sometimes you have to review your work and make sure everything's good and nothing else is adjusted. Let me show you how it looks on my patient, now adjusted. From the front view, I notice now that the bridge is not crooked. From the top view, I notice that no lens is sitting higher. And from the side view as well, it's sitting nice in the horizontal line. And that is skew bridge. For this misalignment, I have a rotated lens. It's affecting the horizontal alignment. Notice that the skew is higher on the left side compared to the right side. In order for me to fix this misalignment, I need to use a alignment axis plier. But first, I want to show you how it looks like on a patient's face and what is affecting. First thing I notice from the front view is that the lens is not sitting correctly. I need to move it by a few degrees in order for it to be flush with the left side. Sorry, the right side. I'm going to notice now the side view. And the top view. From the top view, the misalignment is greater on the top side. And you can see it popping out. Now I'm going to show you how we're going to fix this misalignment. I'm going to be using my Axis alignment pliers. I'm going to take off the glasses. And I'm going to use my pliers and hold it in the middle of the lens and gently turn it just by a few degrees in order for it to sit flat and sitting perfect to each other. Now both sides are equally sitting correctly and the bridge is not skewed. Now I'm going to put it back on my patient so you can see how it looks like. The front view, the bridge is not skewed, is sitting perpendicular. From the top, no eye wires higher than the other side. From the side, no eyelashes are hitting. This is rotated lens. For my next frame, I have a misalignment that one lens is closer to the eye compared to the other one. This misalignment is called coplanar. I'm going to show you how it looks on the patient's face and what is affecting. For this misalignment, the left side is closer to the eye compared to the right side. The right side, the lens is popping out more. From the side view, the vertex is very far away for the right eye compared to the left eye. It's a lot closer to the eyelashes. From the top view, you can notice that the big difference between both lenses. In order to fix coplanar, we're going to have to hold on the eye wire and move it to the desired direction that you want. So I'm going to hold it on the eye wire on the sides. Notice the bridge, it's crooked. So I'm going to hold it on the eye wire and force it in the direction that I want in the opposite direction. So notice that in this situation, my left side is higher compared to my right side that is lower. So you have to notice which way do you want it. I notice that my left side is higher, so I'm gonna bring it down. Okay. Now my alignments with the frames are perpendicular, straight. I'm going to show you how it looks like on the patient's face. From the front view, no lens is popping out. I notice from the top view that no lens is closer to the eyelashes. It's sitting perpendicular to the face. From the side view, this misalignment, coplanar. For the next misalignment, I have Xing. It definitely affects the bridge and the temporal parallelism. I'm going to show you from the top view. Okay. So from the top view, I noticed that the planes are not perpendicular. And when I see it from the top, I notice one side of the eye wire compared to the other side. So now I want to show you how it looks like on a patient's face and what is affecting. Let me try that one more time. Okay. So immediately from the front view, I notice that the temporal parallelism is not perpendicular. The left side is all the way to the bottom. It's not even on her optical center. The right side is higher. From the top view, I see the Xing more excessively. And you can also see it from the side view. This is called Xing. In order to fix Xing, I have to grab the eye wire on the corner. And I have to turn it in the direction that I want it for it to sit flat and perpendicular. So notice that the plane is twisted in the bridge. So now I'm going to hold the eye wire, both sides, and twist it to the desired direction that I want. And now the bridge is straight. I'm going to show you how it looks like on my patient. Goes out perfect. Immediately I notice that the temporal parallelism is nice and flush. It goes in on the ear. The right and the left lens are in the same height. From the top view, no lens is closer to the eye. And from the side view, no eyelashes are touching the lens. And this is called X. For this misalignment, I have temporal parallelism. This affects the temples and how it looks on a patient's face. One lens can sit higher compared to the other lens. I'm going to show you how it looks like from the top view. Okay, so the temples are not sitting perpendicular. So let's say in this situation, I'm trying to see if they are perpendicular. I'll do the test. And they do not touch at the same time. Now I'm going to show you how it looks like on a patient's face. So from the front view, I noticed that the right lens is sitting higher compared to the left lens. From the top view, I noticed that it inclines going down, like a hill look. So on the right side, I noticed that it's closer to her eyebrow compared to the left side, that it's in the middle of the optical center. From the side view, I noticed that the frames are touching her cheek on the left side compared to the right side. In order to fix temporal parallelism, we're going to hold on to the frames and we're going to use a special pliers, the wide jaw angling pliers. And I'm going to notice where the temples are not sitting perpendicular. So I notice that one side is higher compared to the other. So I'm going to use my plier and adjust it. And now I'm going to twist it in order for it to sit perpendicular. Now the frame is sitting perpendicular. Let me see how it looks like on my patient's face. So for the front view, we have both lenses that are perpendicular. I noticed that from the top view, no lens is higher. Both right and left are in the same height. From the side view, I noticed that both sides are touching the cheek versus one earlier only one was touching. And that is temple parallelism. For my next misalignment, I have a temple fold. Notice that the temples, once closed, they are not Xing or not where they're supposed to be. Perpendicular and nice and flush. Once I open them, I notice the temple parallelism is nice and straight. I want to show you how it looks on my patient. So the temple front, I don't notice no misalignment. From the top, they're perpendicular to the front. The eye wire is not bent. From the sides, I'm noticing right now around her ear end, it's straight. And it's straight. This misalignment is called temple fold and affects the last process when you close the glasses. I'm going to show you how they look from the top here. And in order to fix a temple fold, you use your wide jaw angling pliers, and notice that they're not perpendicular. They're supposed to sit in a straight plane. And you're supposed to do this close and go to the direction that you desire. Sometimes you have to do it twice to get the results that you want, but as you can see, it's nice and perpendicular. My temple parallelism is straight. And I'm going to show you how it looks on my patient. Make sure camera's good. Okay. From the front view, the front looks nice and straight. From the top view as well, and the side view. I noticed with temple fold, nothing really changes on the frames. And that's temple fold. For this misalignment, I have temple bend. The temples on this are not where they're supposed to be. This one's too early, and this one's too far. I'm gonna show you how it looks on my patient. From the front view, I noticed that one lens is more out than in. I noticed that the right side is actually outer compared to the left side, especially if you see it from the top view. If you see the side view, I noticed that there's it's too much play where the ear and the temple supposed to bend. Compared to the right side, the bend is not it's not where it's supposed to be. It's supposed to bend a lot earlier compared to here. So I'm going to show you how you fix it. Temple bands. For this demonstration, I'm going to show you how it looks from the top. And notice that if I tap it on the top side, the left side goes up. Both temples should be at the same level, and they should touch at the same time. To correct this, I gotta change the temple end. So I'm gonna straighten out both temples. And remake the temple end to a 45 degree. And no sides are going up. So now I'm going to show you how it looks on the patient. If you notice, now no lens is sticking out more. Both of them are perpendicular and the same plane. From the top view, you can also tell, same vertex. From the side view, I noticed that the temple end turns right where it's supposed to be. That was the left side, and this side is the right side. And it turns where it's supposed to be. Like that, if I ask the patient to look down, it's not gonna fall. Can you look down, please? Look up. Perfect. And that's temple bend. My next misalignment, I have the frontal nose pad misalignment. The frontal nose pad misalignment controls the height of the frames. Either goes up or goes down. I'm gonna show you how it looks on my patient. From the frontal view, you notice that the frames has a shadow where the guard arm is. We're supposed to widen up the nose pad. From the top view, you notice that it's very narrow on the top. From the side view, you notice that we can widen it up. In order to fix this misalignment of the nose pad, we gotta widen up the frontal. I'm going to get my nose pad pliers, and I'm going to grip the guard arm, and I'm going to pretty much widen the lower portion. Like that, it can lower the frame down and it sits nice and flush. Nice. Now you can notice that the frame is not actually lower and there's no shadow. From the top view, you notice that now it's sitting flush with her nose and inside of her crest. And you notice here that now that frame is lower. This is frontal view. The next misalignment, I have the vertical nose pad misalignment. Notice that the vertex of the vertical is actually farther away compared to this nose pad and guard arm. We're gonna see how it looks on the patient's face and how we can fix it. So one guard arm is actually closer to her crest compared to the other guard arm. From the front, it looks like the guard arms are even perpendicular. You can notice from the side view, they just look off. This affects the vertex. Now I'm going to show you how we're going to fix them. We're going to get the needle nose pad pliers and we're going to adjust it. And we're going to get one of the guard arms, the one that is farthest away, closer to the other one for it to sit at the same level. Let's get it from here. You got to be very careful not to change the frontal because then it can affect the width or how narrow it is. You got to make sure that you sit it at the same height so you don't change the vertex. Okay, perfect, perfect, perfect. Okay, now they're both aligned at the same plane. Now I'm going to show you how it looks on my patient. Notice now they're both touching the nose crest, nice and even. From the top view, from the front view, from the side view, and it doesn't look off. Both guard arms are touching her nose, and the vertex distance is corrected. That is vertical nose pad misalignment. I have the splay nose pad misalignment. Once looking at it, you can notice that it's very narrow, it's very flat, and I'm going to demonstrate how it looks on my patient's face. From the front view, you notice that the guard arm and the nose pad is not where it's supposed to be inside the crest of the nose. From the top view, you notice that the guard arm needs to widen up in order for it to sit flush with the crest of the nose. From the side view, you just notice that the low end of the guard arm is the only thing hitting the nose. In order to fix this misalignment, I grab the frames and I get my nose pad pliers and I adjust the splay. And that's opening it up sideways. So let me show you how it looks on my patient. From the front view, I notice now that it sits more in the crust. From the top view, I notice that it's in, and from the top side view, I notice that not the lower edge is touching now. Now it's in the middle. And that is nose pad splay. In order to fix the skew bridge, you need to hold on to the eye wire and go to the direction that you want. So in this case, this side is higher. and the bridge is crooked. So we want it to be in the same horizontal. So I'm gonna hold on to the eye wire and bend the bridge to the desire that I want. It's for it to be perpendicular and flat. Because these are metal frames, some metal frames you can just use your hands and just bend eye wire. Notice now the bridge is nice and straight in the same horizontal line. Sometimes you have to review your work and make sure everything's good and nothing else is adjusted. Let me show you how it looks on my patient, now adjusted. From the front view, I notice now that the bridge is not crooked. From the top view, I notice that no lens is sitting higher. And from the side view as well, it's sitting nice in the horizontal line. And that is skew bridge.